Summarize the factors producing increase in diameter of the thorax. The anterior posterior diameter is increased basically by the pump handle movement of the sternum. Okay, this is the pump handle. It is, you can see it is moving superiorly and anteriorly, just like the way sternum is moving, right? So brought about by the elevation at the vertebrosternal joints from the second to the sixth rib, and partly by elevation of the 7th to 10th vertebrochondral ribs. Okay, so that is the pump handle movement of the sternum, causing increase in the anterior posterior diameter of the thoracic cavity. The transverse diameter is increased mainly by the bucket handle movements of the 7th to 10th vertebrochondral ribs, and partly by the elevation of the 2nd to the 6th vertebrosternal ribs. The vertical diameter is increased by the descent of the diaphragm as it contracts. This is called the piston mechanism. So bucket handle movement causes the increase in the lateral diameter of the thoracic cavity by the elevation of the 7th to 10th vertebrochondral ribs. Also, the vertical diameter is increased by the descent of the diaphragm, and this is called the piston mechanism, right? So you can see over here the movement of the diaphragm, right? During inspiration, the diaphragm contracts and comes down by 2 centimeter. It is aided by relaxation of muscles of the anterior abdominal wall, and during expiration, the abdominal muscles contract and the diaphragm is pushed upwards. Also, the diaphragm is facilitating an inspiration of at least 400 ml of air during each contraction. In females, the respiration is thoraco-abdominal, and in males, it is abdomino-thoracic, basically from where the respiration is beginning. Now, the role of the respiratory muscles. Now, we have inspiration that is caused by the diaphragm, the external intercostal muscle, and the interchondral part of the internal intercostal of the contralateral side. Deep inspiration is caused by erector spinae muscles, the scalene muscles, and the pectoral muscles. As you can see, this is the inspiration basically by the sternum. Then the expiration is basically a passive process, and the forced expiration is by the muscles of the anterior abdominal wall, right? So respiratory movement during different types of breathing. Coming to first the inspiration, there's something called quiet inspiration that we are doing anyways. So here the anterior posterior diameter of the thorax is increased in quiet inspiration by elevation of the 2nd to the 6th rib. The first rib remains fixed. The transverse diameter is increased by elevation of 7th to 10th rib, and the vertical diameter is increased by the descent of the diaphragm, that is causing the quiet inspiration. In deep inspiration, okay, where the movement during quiet inspiration are increased, here now the first rib is elevated. This is the deep inspiration where the first rib is elevated directly here. The first rib over here is elevated directly by the scaleni muscles over here and indirectly by the sternocleidomastoid. The concavity of the thoracic spine is reduced by the erector spinae muscles in deep inspiration. In forced inspiration, all the movement described are exaggerated. Now, the scapulae are elevated and fixed by the trapezius and the levator scapulae and the rhomboids, so that the serratus anterior and the pectoralis minor muscles may act on the ribs, right? You can see over here the pectoral muscles. They are helping in fixation and their forced inspiration. Now, expiration. We have the quiet expiration, in which the air is expelled mainly by the elastic recoil of the chest wall and the pulmonary alveoli, and partly by the tone of the abdominal muscles. whereas deep and forced expiration is brought about by strong contraction of the abdominal muscles and that of latissimus dorsi. Now, so what is dyspnea? Dyspnea is difficulty in breathing, where the patient is basically most comfortable on sitting up, leaning forward, and fixing the arms, as you can see in this posture. So fixing of the arms, basically it is fixing the scapulae so that the serratus anterior and the pectoralis minor may act on the ribs for a good advantage. Now, the height of the diaphragm in the thorax is also variable according to the position of the body and tone of the abdominal muscles. In the sitting posture, the position of the diaphragm is lowest, allowing maximum ventilation. The diaphragm is midway in position while standing, right? And it is highest in lying down position, so that the patient is extremely uncomfortable and he may need to exert immensely for inspiration. Now, the most prominent role in inspiration is played by the diaphragm, okay? Basically, in inspiration, the active phase is for 1 second, and for expiration, the active phase is for 3 seconds. In women of advanced pregnancy, the descent of diaphragm is limited, as you can see over here. So, the type of respiration in them is mainly thoracic. The abdomen has less contribution to it. In young children up to the age of 2 years, the thoracic cavity is almost circular in cross section. So the scope of anterior, posterior, or side to side expansion is limited. And here the type of respiration in children is abdominal. So hopefully you have understood the basics, the superior inferior apertures, and the type of movements, right? So thank you.